Good morning and welcome back to Bernama Today, and I'm Fabian together with my guest Mr. Wee Kee. Welcome down. Mr. Wee Kee is from DBC Documentation Based Care with over 14 years of experience in musculoskeletal problems. Now just a little, let's give a little, history about DBC first before we start. DBC has been developed in Finland as it's a very much evidence-based and has been published over 70 scientific papers and in peer-reviewed journals on the symptoms, treatment and outcomes of back, neck and shoulder conditions. DBC treatments today are available in over 25 countries, and the system is leading turnkey solution for treatment providers committed to excellence in musculoskeletal care. DBC delivers proven solutions to treatment of challenging back, neck, shoulder, knee and other musculoskeletal problems. So Mr. Wee, can you tell us a little bit about DBC and its presence here in Malaysia?
Thank you very much. Good morning, Fabian.
Morning.
And thank you to Bernama for giving me an opportunity to share about the DBC. The DBC technology was brought into this country in early 2000. It's a Finnish innovation based on evidence-based physiotherapy and rehabilitation. As a country aspires to be a developed country in 2020, the government has called for entrepreneurs to bring in high-tech technology, especially in the medical field.
Okay.
And I came to know this technology in one of my trips in London. That was about 12 years ago.
Okay.
A doctor friend of mine from Singapore saw this technology in Singapore and told me that this is definitely the way forward in terms of treatment of musculoskeletal. So we have been here in the market for the last 12 years, and we now have 5 DBC centers in the country.
Right. Now, who can actually use DBC's services? Because DBC services looks like it's targeted to a very specific target market.
All ages in terms of people suffering from musculoskeletal, people who are suffering from lower back problem, neck, shoulder pain, and also in terms of other musculoskeletal problems.
Okay. Okay, tell us about the SOXO Return to Work project.
We started with SOXO Return to Work project in early 2005. At that time, in terms of social security, the number of people suffering from lower back problem is on the high side.
Okay.
And we piloted with SOXO in 2005 in treating SOXO workers and bringing them back to work. If you look at the data in terms of statistics on occupational health illness, lower back problem is one of the highest in healthcare.
Okay. Now, lower back problems. I mean, as we take a look at the visuals over here,
sure.
You can see that the guys are the doctor is actually explaining to him how to exercise and to move his muscles. But what is actually happening? I mean, in terms of treatment-wise, are these the machines that we're expecting to see here?
Yes, the machine is only one of the components in terms of the treatment delivery system. Right. When a patient comes to our clinic, it is normally referred by an orthopedic surgeon or specialist.
Right.
Based on the MRI and X-ray, we will then do an assessment of the musculoskeletal system.
Okay.
The Finnish has developed a technology called the EMG assessment of your lower back, and from that assessment we should be able to know where your musculoskeletal system, where your muscles have weakened.
Right.
From there, the patient will then go through 12 to 24 active exercise section.
Right.
The whole DBC concept is based on active rehabilitation, active exercise, active conditioning of the muscles.
Right, well, that was golf, that means.
Yes.
Because we've seen the guys playing golf there.
Yes.
All right. How is DBC different from the normal physiotherapy?
Yes, I would say that we complement the DBC normal physiotherapy. Is a value added.
Okay.
The DBC is driven on evidence based. Evidence based here from a scientific approach. The approach a patient goes through is formally documented in a clinical perspective, where a patient goes through an assessment. The results are then documented, and then the results are then shared with the doctors, and then we put the patients into an active rehabilitation program in our clinic.
Right. Now, how does DBC's exercises improve one's health condition? Okay, let's talk about. Okay, maybe let's make it a little bit more open-ended. Let's talk about lower back problem.
Right.
A lot of people have lower back problems. Let's say if I were to go for physiotherapy, now how does this company DBC actually complements as is a value add-on, right? How does it complement to this treatment?
Yes, if Fabian, I mean, if a patient suffers from a lower back, normally it's referred by a by an orthopedic surgeon.
Okay.
When the patient comes into a DBC clinic, we'll take them through a baseline assessment. From a baseline assessment, we'll then put them into 12 and 24 active exercise. If you could see the machines are innovated and designed in Finland, especially designed from a biomechanical perspective, looking at the lower back.
Okay.
And the machines then actually, I will work on the muscles and separate the muscles and strengthen the muscles, and thereafter the musculoskeletal of a patient will be strengthened.
Right. Other than this, what are DBC's other services? I'm sure you have a range of other services.
Yes, apart from the clinical, in terms of treatment of lower back musculoskeletal problem, we also, have gone into sports rehabilitation, sports physiotherapy. Currently, Felda Super League team.
Okay.
A number of players of Felda are now actually in our clinic in terms of the recuperation, in terms of bringing them back to the field.
Okay.
Some of them have injury in terms of knee injury and other parts of the musculoskeletal system.
Are you working with the government with this, or are you planning to work with the government or the football league or maybe hockey?
We are actually. We are promoting this to the various associations of sports. The technology itself is pretty advanced in terms of sports rehabilitation. It's also in terms of, as you've seen, in terms of the golf strengthening. A lot of golfers come to our clinic. They have actually musculoskeletal problem, shoulder, and also in terms of lower back. So the DBC system has actually a very good treatment modality in terms of strengthening back the golfers' musculoskeletal system. Some even have claimed that they have a good swing after they have come to our DBC center.
Wow! Is that because people? Every swing counts, right?
Yeah.
And every swing not only makes use of the lower back, it also makes use of the hand, and it makes use of the whole body, right? Tell us about DBC's success rate, because we've heard that you have many patients already at your place. Now the success rate. Let's talk. Tell us a little bit about that.
We have been in the market for the last 12 years. We have treated more than 5,000 patients in Malaysia. We started with Social Security, and also now we have a good referral from the private hospitals, from the orthopedic surgeons. In terms of success rate from a clinical evidence-based perspective, worldwide, DBC International has set standards for all the clinics worldwide. That is basically 83% in terms of pain reduction and 75% in terms of functional improvement. That is a standard set by DBC International Standard. And all the clinics worldwide will have to go through quality assurance every 6 months.
So they actually come here, check your place, whether it's all right.
And your clinical data. And one of the good news is that our local clinical results have been validated by a local medical university, IMU. And the local clinical results are almost on par with the international standard in terms of 83% pain reduction and 75% in terms of musculoskeletal functional improvement.
Other than exercises, are there medications to add on to this?
On our part, I think we do not prescribe medication. We work very closely with the orthopedic surgeons, spine surgeons, the neurosurgeons, and the rehab doctors. This is the way forward in terms of an integrated approach towards the rehabilitation of musculoskeletal problem.
It looks like it's a separate division. Like you just come in and say, okay, I'm going to do this. I'm going to help you get better. But the rest comes from the surgeon, from the expert itself. Is that an extension arm of the hospital? Is that something like that?
You could say that, Fabian, but to a certain extent also, if you look at all our 5 centers at this moment, it is all independent centers. That means away from the hospital.
Right.
But of late, we do actually have a lot of requests from private hospital in terms of looking into our technology and also exploring in terms of possibility of putting our technology into the private hospitals.
That's what I thought, because it's easier to be in the same building than actually going another place.
There's also another school of thought that says that you are suffering a lower back problem. They would like to go to a place like DBC where it is away from a hospital, and the ambience is set up in a very nice manner in terms of psychological aspect, in terms of recovery. There is some element in terms of psychological effect towards recovery of lower back problem. But we're not saying that we are not working with with hospitals. We work very closely with the orthopedic surgeons. We work very closely with the medical practitioners, and also we work very closely with the insurance, the payers. So a couple of insurance companies in Malaysia have also recognized DBC in terms of a non-surgical early intervention towards the treatment of lower back problem.
So it means people can actually go to your place and say, hey, I want to claim from my insurance.
Yes, provided that it is actually referred by a specialist.
See. So that means they still have to go to the hospital to get the recommendation to come over to your place.
Yes.
Right. Okay. Now, you mentioned you have 5 centers.
Yes.
Yeah. Can you just tell us the location of the centers and probably your future plans?
Yep. Thank you very much, Fabian. We have 5 centers, 3 in the Klang Valley. Our nearest center is in Mbok, Ampang.
Oh, okay. Just now.
That is a center of excellence. We have the 4 modules of evidence-based physiotherapy, which covers the back, neck, shoulder, and knee. The other center is in Klang, in Bukit Kuda.
Okay.
And our third center in the Klang Valley is in Kepong, in Forest Medical Center.
All right.
There is a push now. Previously, we had 1 in Taman-Tun, and we are now looking into a possibility of setting 1 in the Damansara area.
Right.
And the other 2 centers away from the Klang Valley, we have 1 in Ipoh, and also 1 in Kuching. Kuching is another beautiful center of ours with about 5,000 square feet. Our future expansion plan, Fabian, we are now looking at Penang, JB, and Kota Kinabalu. That would actually give us a strong national presence in terms of having major presence in Malaysia in providing musculoskeletal treatment to the society and the public.
Any timeline for this? Because from my experience being a Penang boy, and knowing that there are many Indonesian people that actually fly down from Indonesia to Penang to get health services, not only on treatments but also on surgeries, this and that. Well, so what's your timeline? Kind of opening, just to give people a heads up. Probably I can come over to take a look at the place. If my mom or my dad or my friend had this problem, probably a timeline.
The timeline is the next 12 months.
12 months.
And we are seriously looking into Penang and Johor Bahru as well as Kota Kinabalu. I agree with you in terms of to support the Malaysian government in terms of health tourism. There's a lot of opportunities that DBC can work with a private hospital in promoting health tourism in Malaysia.
Any probably an option that maybe you would like to work with the government, with the health ministry maybe?
Yes, we are closely in touch with Ministry of Health. They have evaluated this technology about 3 years ago, and we believe that DBC technology has a lot of opportunities to be placed in a government hospital. This is a technology which is, I believe, is quite ahead in terms of time, and we believe that we could actually contribute towards the national healthcare system by bringing new technology into the rehabilitation and physiotherapy area.
Right. Okay. Any contact details that we can actually see from, or
yes,
a website maybe?
Yes, the website is www.dbcsam.com.
Oh, there you go.
So
dbcsam.com,
and the Finnish website is www.dbcfi.
dbcfi.com. Okay, this is an international website or is it a local website?
www.dbc.fi is an international website.
Okay.
And the DBC SAM is a local website.
It's a local website.
Yeah,
okay.
Thanks, Fabian.
All right, we're going to wrap the show up. Thank you very much, Mr. Wee, for coming in early in the morning, waking up, going against the jam in Jalan Tun Razak to be here with us here today. Thank you very much for coming.
Fabian.
All right, that's all we have for Bernama today. Thank you very much, Dr. Wee. I always mistaken him for a doctor. He's not a doctor, he's an accountant by profession. But look where is he today, medical industry. Very good.
Thank you very much, Fabian. Thank you.
You're watching Bernama Today. Stay tuned for more news updates right here on Bernama TV.
Thank you.